Thank you everyone again for joining. My name is Karine Fleming. I am your moderator for today, and I am a clinical nurse specialist working at Toronto General right now, and have the great opportunity and pleasure to help moderate this session with some colleagues I enjoy very much working with. And so I'm just going to go through some housekeeping items first. And our particular session today, just to let you know, is the Ontario Health Sickle Cell Disease Quality Standard, working together to improve care. I will introduce our speakers after I run through our housekeeping piece. All right, so if you or members of your network would like to refer back to the information shared in this session, a recording of today's session will be posted on our website at www.sicklecellanemia.ca for viewing at your convenience. In this session today, we will be hearing from Karine Baser, Carol Kennedy, and we have some co-facilitation by Dr. Madeline Bohorsek, and I also will join some co-facilitation. I'm going to start off, I've said this 3 times, but with a few housekeeping rules. Sorry, it's in my script. We ask that you please save your questions, thoughts, or concerns until we're into our breakout rooms where you can have a bit of discussion. And then when we're reporting back, you also can have opportunities then. We kindly ask that you respect the learning being done in the space by abiding by our following housekeeping rules. Your microphones have been disabled, so if you would like to ask a question, please do so by putting your questions in the chat or the Q&A or by raising your hand. We will try our best to answer all questions during today's session. Today, there are translation captions available as well. So you can listen to this session in your preferred language by clicking by clicking Show Caption at the bottom of your screen. Check the Enable Translation checkbox and choose the language in which you would like your captions to be translated in. Please use respectful language in the chat, no profanity or inappropriate images or posts. Please do not post other material unrelated to today's discussion topic. Keep discussions and comments on topic as much as possible. SCAGO does reserve the right to pause the session or to seek removal of participants who do not abide by these rules. Thank you for your understanding and agreement to positive participation. I'm just going to move into our land acknowledgement. We're gathered today because of a shared commitment to equity, including health equity and reconciliation. I encourage you to reflect on what that means for you and your work and in your lives from coast to coast to coast. I'd like to start by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I'd like to take a moment to acknowledge the importance of the land, which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territories of all the Inuit, Métis, and First Nations people that call these lands home. Now I will introduce our speakers. Karine Baser currently works in the Quality Division at Ontario Health, leading the development and execution of strategies to support implementation of clinical and quality standards across the province. Karine holds a Bachelor's of Nutritional Sciences from the University of Guelph and a Master's of Health Administration from the University of Ottawa. She has worked in the Ontario health system for over 15 years and brings experience from her work in change management and quality improvement in hospitals, primary care, and the home and community sector. Carol Kennedy has a clinical background in physiotherapy and training in health research methodology. She is currently a manager in the Clinical and Quality Standards Program at Ontario Health. In this role, she supports the development of quality standards. Carol co-led the development of the Sickle Cell Disease Quality Standard and is now supporting dissemination and implementation. Dr. Madeline Bohorsek is a professor of medicine and pathology and molecular medicine at McMaster University. She's the director of the Adult Hemoglobinopathy Program at McMaster University Medical Center, consultant laboratory hematologist for the Red Cell Disorders Laboratory, and the chief of medicine at St. Joseph's Healthcare Hamilton. Dr. Bohorsek is on the board of directors and executive of the Canadian Hemoglobinopathy Association. Thank you all for joining us today, and I now hand it over to you to start our wonderful presentation.
Thanks, Karen, and good morning, everyone, and thank you for being here on a Saturday morning, bright and early. We're really happy to share some of the work that we've been working on in consultation and in partnership with so many people across the province, including our great partners at SCAGO. We'll have a couple of little slide to begin with. Maybe we can just go to the next the agenda slide here. So I'll walk through kind of the next steps. We'd love to start with a little bit of a poll to see who's in the room and where you're coming from this morning. And then once we get through that, Carol will provide an overview of the sickle cell disease quality standard. I will talk through our plans for implementing this quality standard. And then we're going to jump into an interactive group discussion led by our capable co-facilitators, and looking really forward to hearing from you and hearing your experiences both as clinicians and as patients and caregivers and family members. So really looking forward to that discussion. There will be a couple different breakout rooms that you'll be randomly put into, and we know that everyone comes with a lot of experience in the system. So know that no matter which one you're selected into, that you've got great insights to share from your perspectives. So don't worry if it doesn't feel as comfortable to you. And then we'll wrap up with a few closing thoughts from Madeline and myself. So that's our plan for the next about 55 minutes. And hopefully you all see that there's a poll up in front of you. So please take a moment just to tell us, what perspective you're bringing today, this morning, and where you're coming from.
I'll leave the poll up for a few more seconds. We have about half of our participants have answered, and then I will end the poll shortly. So I'll end the poll now. We've got over 65% participants. So I'll just scroll here so you can just see who your attendees are.
So just a couple of reminders as we go into this session. Of course, we welcome you to turn on your video, particularly in the interactive discussion. We want to hear from you. We'd love to see your face if you're comfortable. And absolutely, conversation in the chat is encouraged. So please ask questions if you have them. We'll do our best to answer them. And of course, just remember to mute yourself when you're not speaking. I saw that the poll popped up briefly.
Sorry, I didn't know if it was a good time to pop it up here.
No worries. Yeah, that's great. So yeah, this is really helpful. Thank you for sharing. It looks like we've got a pretty good mix. We've definitely got some patients, family members, and caregivers in the group, but lots of clinicians, administrators, healthcare professionals, and of course, some people who wear both hats. And then, yeah, okay, so we've got lots of folks from acute care and a few from some of the other sectors as well. And it looks like at least half the group is very aware of the quality standard. Great to hear. We're really happy about that. And then with a mix of a few people who are still learning about it. So this is great. Happy to hear that people are learning about it. Maybe we'll keep moving unless there's anything I've missed there. And I'll let Carol speak to this first section.
Thanks very much, Karine. And so I'll just be giving a high-level overview of the sickle cell disease quality standard. But I want to start by acknowledging the amazing support that we had throughout development of the quality standard from our advisory committee. The committee members are listed here, and you'll see we had large representation from people with lived experience, as well as clinical, healthcare administrators, researchers across the province of Ontario. Next slide. And without the work of those people, we could not produce the quality standards that we produce. We have really strong collaboration with our advisory committees to work on development. So for those who are not familiar with quality standards, they inform clinicians and patients what quality care looks like. We focus on conditions where there are large variation in how care is delivered, or where there are gaps between the care provided in Ontario and the care that patients should be receiving. They're grounded in the best available evidence. So we use clinical practice guidelines, We do a lot of engagement with people with lived experience and organizations, patient advocacy organizations like SCAGO across the province, and we also, as well, our advisory committee. And then we do a large public consultation at the very end to try and get more broader feedback on the draft standard. Next slide. So quality standards help patients and caregivers know what to ask for. They help healthcare professionals know what care to offer based on the evidence and expert consensus. And they help healthcare organizations measure, assess, and improve the quality of care that they provide to ensure there's consistent, high-quality care across the province. So this slide is not telling anyone here, I don't think, anything new, but when we start development of the quality standard, we develop why the standard is needed, and this summarizes that sickle cell disease is one of the most common inherited red blood cell disorders, affecting about 3,500 people in Ontario. Sickle cell disease mostly affects racialized people, particularly those who identify as Black, and Black people experience anti-Black racism in their interactions within the healthcare system, which negatively affects their healthcare outcomes and their experiences. Next slide. So the scope of this quality standard is broad. It covers care for young people and adults with sickle cell disease. It addresses screening, prevention of complications, the assessment and management of acute and chronic complications, and the use of disease-modifying therapies. It applies to all pediatric and adult healthcare settings, and it includes hospitals, emergency departments, primary care, specialist care, and home and community care settings. Next slide. The Sickle Cell Disease Quality Standard is one of Ontario Health's deliverables on the Black Health Plan, the first provincial plan dedicated to advancing Black health. And the Black Health Plan was developed and stewarded by a diverse group of community members, health leaders, and academics. We've provided a link to Ontario Health's Black Health Plan in the slide here, and we'll put it in the chat box as well. And on the right side of the slide, you'll see the quality statements or topic areas that were identified by our advisory committee as key areas for improvement in Ontario. So these are the topic areas that the quality standard is focused on. Next slide. When we release the quality standard, we produce a number of products associated with the quality standard. So we have a patient guide, which is sort of a shorter version of the quality standard that's targeted to patients and caregivers and their families. We produce a 2-page placemat that is targeted more to clinicians and healthcare settings, sort of as a quick reference guide for clinicians that summarizes the quality standard with tools and resources that can support implementation of the quality standard. We have a generic getting started guide that is there for healthcare providers, their teams and organizations, as sort of a step-by-step process of how you can put the standard into practice. And the standard includes a number of measurement indicators, and the measurement guide has additional detail on how organizations can measure improvement efforts when they're implementing the quality standard. The next slide is from Serena Thompson. It's in our Case for Improvement deck that is released with the quality standard. Serena was a co-chair of our advisory committee and a lived experience advisor on our committee. And I'll just share a part of this quote. One day from Serena, one day I showed up in the emergency department in a crisis, but instead of being fast-tracked to receive emergency care, I had to wait another hour before I was in a room and then had to wait longer to receive medication. I was then given a high dose of opioids while in a hallway, unsupervised. In this case, my advocates had to ask the nurse for the hospital's sickle cell disease protocol, which they had never heard of. Once they located it, I was immediately moved to an observation and treated. I then was admitted because of the time it took to administer analgesia. So the quality standard, we heard these stories like Serena throughout our engagements with people with lived experience with sickle cell disease. And the quality standard is there to acknowledge the challenges that many people face when seeking care, not only in the emergency department, but across the healthcare system. Next slide. And I'll pass it over to Karine to speak about our implementation plan.
Thanks, Carol. So this is, I'm going to speak about how Ontario Health and is sort of helping to convene implementation plan that isn't only about what we're doing, but how we're working with partners across the system to advance the care received by all people living with sickle cell disease. And really, it is grounded in the idea that this is not only about improving care for people with living with sickle cell disease, but it's about improving care for all Black people accessing healthcare in Ontario by challenging the anti-Black racism that people with sickle cell disease experience, as Carol described in that example shared by our co-chair Serena, which is shared by so many others who access care in emerges and in other settings in Ontario currently. The vision for implementation is also around how do we bridge the gap and between sort of a quality standard, which at times can be sort of, it's challenging to implement a quality standard, and how do we do that in a very practical way at all levels in the system. And the approach we're taking is really to lead with an integrated approach that leverages the strengths of our partners and leverages the strengths across Ontario Health, now that we are one organization and we can influence some of the groups under the roof of our overall organization. So we're excited for this quality standard because it's sort of one of the first that we're implementing under this new organization of Ontario Health. Next slide, please. Of course, any quality improvement journey is, it takes time. We see this as a multi-year journey, of course, starting first with efforts in acute care, recognizing that EDs are sort of one key point of contact between people living with sickle cell and the healthcare system where inadequate care is being received. Of course, there's obviously opportunities in other parts of the system. We certainly want to work on the clinic care received by outpatients at the dedicated sickle cell disease clinics. And of course, make sure that people can access good care through primary care close to home so that can actually avoid ED admissions and hospital admissions. And our hope is to work to spread and scale the great work done by early adopters and clinical leaders. I'm sure some of you are on this call today and you are part of the quality process that will follow in the coming years. Next slide, please. So this is in a nutshell, and I won't spend too much time here, but give a sense of sort of, the elements of our quality improvement or implementation strategy. So starting first with accountability and funding. So I think what's exciting, and Carol has already spoken to this, is that accountability for this work has already been built into Ontario Health's annual business plan by articulating our commitment to equity, as evidenced through our Black Health Plan and the implementation of it, which includes the implementation of the sickle cell disease quality standard. The other components here include, making sure that any accountability agreements around the functioning of sickle cell disease centers includes language around sickle cell quality standard and ensuring that is followed. And of course, making sure that adequate funding is available to ensure the functioning of sickle cell disease clinics and other supports. We also want to ensure that there are the instrumental supports available to support quality improvement in the field. So some of the activities they'll speak about in the next coming slides includes the development of an e-report, the development of a co-created toolkit, as well as a community of practice, a provincial community of practice that we hope to launch in the new year. And of course, we're not just working as a quality division to make these changes, but we're working across Ontario Health. So I'll talk a little bit around the quality improvement plans for 24-25 that are soon to be released, and some exciting news there. We're also working with our regional partners as well as various regional networks, including the provincial ED networks, to raise awareness of this quality standard and the importance of implementation. And of course, dissemination in education is a key component to any implementation strategy. Next slide. I think I've spoken about this one already. So pillar one, really around accountability and funding. You know, I think this has been reflected in my previous comments that there is efforts right now, and perhaps some of you are aware that there are discussions to create new dedicated sickle cell centers or satellite sites. And I'm sure there'll be news around that in the months to come. I'm going to flip to the next slide just in the interest of time. One of the supports that we know for the past is really critical is the availability of good data and good recent data. So we have created an e-report that acute care sites can look at, regions can also look at to understand how they're doing on a number of sickle cell indicators. And I will flag that we'll provide a bit more information on this in the closing of this session. So if you don't have access to this e-report and you're trying to drive quality improvement work in your hospital, please feel free to reach out and we will get you connected so that you can see this data. Next slide. The other component is around, really building some implementation supports that are both co-created. So working with early adopters to identify change ideas. The intent of this toolkit is that it will be live and that we will iterate it based on lessons learned from those who are doing the work, and that it will provide practical resources that support you or clinicians or physician leaders as to do the work and lead the work. Next slide. And in terms of a little bit of a timeline for how we will start sharing some of these provincial knowledge translation supports, we are hoping to release our first version of the toolkit in alignment with the announcement around new QIP equity indicators, and hoping we'll have that toolkit out by early December of this year. As mentioned, we've heard the need loud and clear for our provincial community of practice. And the hope would be that we launch that in no later than spring 2024 with a focus around the work in EDs as well as the work needed across the sector to address anti-Black racism. And then later in the year, as we sort of iterate our toolkit, release an updated version of that based on lessons learned from early adopters. As mentioned, we work currently and will continue to work in partnership with the regions. Obviously, there's a different approach that gets taken across the different regions based on local context, but all of them grounded through the work being done to introduce equity indicators into quality improvement plans. So I will mention this is the first year that equity as a dimension of quality is being built into those quality improvement plans. And there are going to be some indicators around sickle cell disease, which we're just delighted about, which really reflects our commitment to improving care in this area. And that work will be supported by some of our networks and partnerships. Lastly, the pillar around dissemination and education. I'm not going to read through all of this, but suffice to say that there has been a lot of effort over the last 8 months since the release of this quality standard to raise awareness of the importance of this work. And I will mention that we've got a provincial equity and QIP webinar coming up on December 7th. It's targeted at clinicians, administrators in hospitals. Really hope that you will join if you are part of that audience, and we'll put up some more information about this at the end of this webinar. There are other opportunities as well for education. We want to really call out the great work done by SCAGO to create the sickle cell education program. So hopefully people are starting to access those modules and share them with clinicians in their organization. And last slide, I think, last but not least, yes, just want to share that this work cannot happen without working together. Really, we see this as a system improvement effort and strategy grounded by an evidence-based quality standard, but really put into action by so many different players, including the ministry, our partners across Ontario Health, advocacy groups like SCAGO, who have been so instrumental to raising awareness of the importance of this issue. And of course, healthcare providers who have to do the heavy lifting to do quality improvement on the ground. So just really want to highlight that this is truly a group effort, and we're so grateful for the partnership of everyone around the table. And that's it for my section. We are going to now move into an interactive group discussion. Karine, do you want to kind of walk through this quickly?
There we go. Hi, everyone. Thank you guys for a great. Oh, thank you guys. For a great start. Oh, I just hear myself. But guys, we're going to have an opportunity now to move into one of two breakout rooms. You will automatically be assigned to a breakout room, but I'll let you know what the two breakout rooms are. The first one is emergency care department. So really having an opportunity, thank you very much, to discuss care with respect to the standards in the emergency care in the emergency department, and what are some opportunities for change, or even strategies you're already using that have been successful, being able to share that with others. And then breakout room 2, comprehensive care planning. And this certainly is a huge gap, I feel, kind of being able to pocket myself within different hospitals. Very important for our patients, but how do we actually come up with this? What should it look like? Do you have a care plan that perhaps you want to talk about in the breakout session? Then you can share that, and then we will come back to discuss things. So in case there's any little tidbits, someone was in the wrong group, they're in a different group and they had something they wanted to share, you will have an opportunity to pop it into the chat or into the Q&A once we come back for our report out. And lastly, we'll do a group reflection around the racism and anti-Black racism quality statement number 1. So now you are going to magically, I feel, on your screen will appear join breakout room number 1 or 2. So we ask you please to go forth, have great conversations, and we will see you in about 15 minutes.
Well, I can just talk about Trillium Health Partners, which is where I work as a pediatrician, and we've been working with SCAGO. Thank goodness for SCAGO, to apply for funding to the ministry for comprehensive care. We're in a large community center with a huge population needing this service, and we've made great strides in the pediatric aspect of this, but not so much in adults. So if anybody has any suggestions about how we could, the adult hematologists say that they're very stretched and that they need someone, a clinician dedicated to this in order to make it a go. So I find that frustrating, but we're going ahead with pediatrics and trying to organize some transition navigation anyway.
So when you say, if I can ask, Anne, for the adult setting, they need someone dedicated to this, what is that this? Is it a comprehensive, comprehensive care requirements for adults, or is it more of the transition piece from, on the adult side for those coming from peds to adults? I just want to
it's really a clinician, an adult hematology, like benign hematology clinician that they're trying to find a champion, and someone with the special expertise they feel for this area, and that's the barrier at the moment. And I understand across the province, I don't know what other people experience, that it's also very in short supply.
Yeah, anyone else want to comment? I see some things in the chat, but if anyone wanted to unmute, please feel free to comment. Okay, so Sarah said, okay, an adult doc with the focus. Yes, I agree with you, Sarah, there. Michaela said, in our facility, this is also a need. We have pediatric generalists servicing clinic, and this results in great level of support from sick kids, which causes frustration. Frustration for your adult side, is that what you mean by that, Michaela? Because the ped side, and commonly, right, the ped side tends to have quite a bit of support, lots of resources, and the same way Anne had mentioned, really being able to make strides a bit more, I would say, tangible in nature. And so what do you mean by frustration? If you don't mind unmuting, Michaela, and telling us a bit about that. Or you can type it in the chat.
Karen, can I just speak on our clinic just for a second there while Michaela's typing in? I think what she's saying is we have a generalist, not a hematologist, pediatrician, which causes us to have to reach out to sick kids for support, which in turn causes frustration within our own clinic, with our own providers and our patients. And I think that's what she's talking about. And while I have the forum, can I ask Anne, did you actually start your sickle cell clinic in Trillium Health Partners? And if so, what patient populations are you taking? Because we're still seeing a large number of patients from Mississauga and Credit Valley.
Sylvia, I recognize your name and appreciate, I think we had a conversation about 3 years ago when I tried to start this initiative. And the answer is we have not started yet. Our administration is waiting for a formal response to our funding request, which we submitted collaboratively with SCAGO, Windsor and Thunder Bay, I believe, are the other two centers that we've all jointly made a request. So in fact, you are still seeing some of our patients, and Sick Kids has let us know how many of our patients or our sort of catchment area are in Brampton and people that they serve. So no, we're eager to start, but our administration won't give us the go-ahead, and we don't have the nursing and allied support until we get a funding announcement.
Okay, good luck with that.
Thank you for that, Sylvia. Michaela, I wanted to let you know I was going to try to unmute you, but I cannot even see you on my panelist. Like, I don't see you on my list. So I want you to continue. Oh, there you are. Okay, here, allowed to talk. So you should now be able to unmute yourself. Ask to unmute. Boom. I'll do that for you. So now you should see something on your screen that says I want you to unmute. And if that doesn't work, I'll go to our next person who has their hand up, and we will continue trying to make sure you can share your thoughts. But thank you for clarifying, Sylvia. I didn't actually honestly appreciate that pediatric hematology was a challenge, because adults, yes, we always know that. But to know pediatric generalists versus pediatric hematologists, really, that there are some gaps there as well. Thank you for raising that. I'm going to move on to Denise for now, and then we will see how Michaela does. So Denise, please go ahead.
Hi, you may have already explained this, but when you say comprehensive care, are you speaking specifically for adult care or the transition between leaving from pediatric to being an adult? Or do you mean like overall care?
So patients with sickle cell ads, whether it is you're a warrior yourself, or you're a caregiver, or you're an actual clinician, or you play some other fantastic role while you're here today. It's that they need the wraparound care. They need someone who can manage their ongoing primary function, like everyday care questions they might have. They also need someone who can manage their specialist type of care around sickle cell and manage all of those follow-ups that come with that, making sure that their bone mineral density tests get booked, their echoes, their audio, their eye tests, and making sure those pieces happen along with any sort of medication regimens, ensuring that is all in one location. So comprehensive care, just making sure all the needs of the patient that this particular patient population has is being met, and hopefully within one center or a center that collaborates with other centers, but it's still somewhat seamless and not fragmented for the patient. So that's how I would explain it. I'm happy for anyone else to.
Okay. Yeah, thank you. I think that's a good answer. Because I'm a caregiver, I'm a parent of 2 children with sickle cell. So, but I believe that we mainly go to we're in Ottawa, so at the CHEO, we mainly go to the hematology department, and they do very well in helping us to maintain any particular checkups or follow-up or extended departments that we need to get checked for, like, ophthalmology and not so much cardiology, but ophthalmology and all the other areas that needs to be followed up at different times in their lives, I guess. So that's how we've been doing it. But I've heard that, of course, maybe in the future, as there has been some problems with other people, is that when you become an adult, then you have a greater problem because you don't have that team who has always been there somewhat assisting you with your ongoing health.
And so, yeah, anyone else can jump in at any time, guys. This is very meant to be informal and not a lecture kind of thing. But for my experience with adults, it's because you have so many tests and providers that are not in the same spot. For pediatrics, I find most of your testing that's happening is in that hospital. You're not having to go to a different center, and the team that you see as your hematology team manages kind of all your appointments and very much so coordinates all of your care. When you move into adult care, you are the owner of the info and are the one. Then there's a lot more put on adults to self-manage care, to be able to coordinate your appointment, make sure you call for your follow-up appointment. Well, generally follow-up appointments I find get booked, but the actual onus, a lot of onus goes on the patient to do a bit of the coordination piece. And then just I find too, you might have one test booked at Toronto General for my center where I'm at, and then you might have another test that's booked at Toronto Western. You might be across the street at Princess Margaret for some other test on different days. That's the other thing too, right? I worked in pediatrics as well. So that's my thoughts. I saw a hand go up. Did someone want to comment on that or anyone else? Oh yes, please. Michaela has her hand up. Go, Michaela, I hope we can hear you. I see your hand up, but if not, you might want to do chat, or if you do want to try to sign in, you're still trying. I don't know if you want to try to sign out and sign back in. I found for me that is the trick when I can't be heard. So if you do want to do that, you do have time to sign out and sign back in. Okay, so I'm just going to see a couple things in the chat here so I can share those. So Michaela said she'd like to propose hematologists perhaps be utilized to rotate between sites to support physicians in learning/managing. And I think that's not only a great idea, I think could that be done also like virtually? Could there be like a virtual session and doctors from different centers could log in at the same time to kind of get a kind of like, let's all talk about things together. I think also that's good just to hear from each other and to build some more comfort and confidence in your skills by being around others who are also trying to support this patient population. Dr. Sarah Patterson said our clinic uses a hub and spoke model, but one of our foci is on supporting our colleagues who aren't physically located at a red cell center. It's definitely a challenge, and I'd love to hear more from everyone how we can improve things. Okay, I was going to say, and my audio, okay, thank you, Sindhu, for sharing. And Sindhu said the coordination can be overwhelming for young adults in adult care, as well as those with additional challenges. For example, people with intellectual disabilities, people with limited support. So focused care navigators could be helpful. And Sarah agrees. Any other comments? So focused navigators, and we talked about also a hematologist who can kind of like almost a hub and spoke hematologist, kind of either when they do move from center to center, or is there a way for that person to do group things or both? So hematologist.
Karen, in Brampton, we have started an adult sickle cell clinic. Unfortunately, we're not transitioning right to William Osler as we share care with sick kids with our patients. We are a satellite. So they're presently transitioning to Toronto General. We are working on doing a seamless transition from our pediatric sickle cell clinic that runs at Peel Memorial to the adult sickle cell clinic that runs at Brampton Civic. I mean, it's in the works and it's part of the standards, so we'll get there. But that way, then the kids and our patients know the area, they know the emergency department of the hospital that they're going to transition to. Hopefully it's seamless. We get involved with the adults, the adult hematologist has attended our clinic in the pediatric area. And hopefully we increase our numbers and patients are happier with that transition. It's a little bit easier for them as they grow into adulthood.
I think it's a really great point. Thank you for bringing that up, Sylvia. It reminds me of some of the lifespan. I always say longitudinal, but because it's, I think, length, but lifespan centers where peds and adults are actually in the same location. And so with respect to knowing the organization, they know it right from childhood right through to adulthood. And it's just a few providers changing because they will actually even still have some peds providers who cover peds and adults. So they actually have some providers who they keep for their lifetime, and then some providers who will be new, but there's some consistency. I really love, lifespan clinics. I truly think it is brilliant. Shout out to London. I know they're doing that. Mac, I'm pretty sure you're a lifespan clinic yourself. And I think that's it. Like Sickle is across the street from TGH. So it's not quite, when I think of lifespan, I think you are in the same location. That's part of the bonus of it. I think that's really one of the things we're supposed to highlight. Thank you very much. I was just about to say, guys, I really think we need to bring our breakout to an end because it is 9 minutes to 10. So I thank you all very much for your participation and the suggestion, whoever made it, that we do our own breakout. Thank you. Thank you very much, because it was a great idea. I appreciate you guys. We'll just wait for others to join us back in this room.
Distance and
Oh, there we go.
I wanted to let you guys know that in our room, we had a few people left over. So we created our own breakout room and we did number 2. So we were breakout group number 2.
Oh,
okay.
Just so you know, so we got it. If we do a little reporting back, we are 9 minutes to 10. So I'll see what direction you guys want to take. Thank you. And so do you want breakout room? Do we want to do some quick report backs, like, a minute per group kind of thing? Maybe breakout group 1, whoever wants to take the stab at that, and sharing with us for the emergency room, what your conversations were like and what you'd like to share with us.
Oh, for someone who's not an expert in the field at all, it really warmed my heart that this small group of people are going to connect afterwards and figure out how they can really share learnings in their own organizations, and maybe even embed some patient advocacy tools in digital platforms. So to me, that we won the lottery today when people are sharing emails and wanting to share experiences to spread wins. So that's, I think, my take home anyway from facilitating that session.
Love it. Thank you so much. And any other comments for emergency room? Otherwise, I'll ask for comments, like a 1-sentence comment for the comprehensive care planning group. Yeah.
I'm happy to jump in from a comprehensive care standpoint. So in our room, we had a great discussion, and we were small but mighty with representation from pediatric hematology, patient lived experience, midwifery, and adult hematology, as well as from Ontario Health. And I think there was acknowledgement that even when there are comprehensive care centers, it's so important for their approaches to be standardized or harmonized in some way. And again, that theme of networking came up, that idea of sharing experiences, sharing standards. And we did reflect a bit on what that might look like, if that could be either a branch off or some sort of a side benefit that comes from the quality standards. And then as well, we did have some other discussion, just thinking about what the sickle cell newborn screening reporting looks like, and whether we're fully maximizing the benefits of the information that comes from that, particularly as it relates to reporting newborn screening results of infants who have sickle cell trait, in addition to the current reporting that happens for those with sickle cell disease. And there were some emails exchanged in our discussion as well. So thanks to the group.
Love it. The one thing I just want for our group to highlight is we really got to talking about the lack of adult benign heme clinicians, and also peds. Like for me, that was a bit newer, around the gap in peds hematology, not having a hematologist and having to consult with sick kids, and that frustration that can delay care. You're always having to lean on someone, even in pediatrics. So for us, that was kind of our conversation, is that gap in hematologist support. And could there be maybe a rotating hematologist, one who goes and helps supports people at different centers, or a central hematologist who then people could reach out to as needed. We are at the last 5 minutes, so I see our poll has been popped up for us. And please, I don't know if we had any additional slides from the team that you guys wanted, any last minute slides. before we end our session shortly, if there's anything else you guys wanted to share. Thank you.
Yeah, absolutely, Karen. Thanks so much. And I wanted to say that because our breakout sessions went a little bit long, we didn't have a chance to get to the anti-Black racism statement, which underpins the whole quality standard. And I'm really sorry about that. But I will say it was great to have some rich discussion in the breakouts. I do want to identify that actually this statement number 1 is actually a core component of what will be presented and highlighted in the Advancing Equitable Healthcare webinar that's coming up on December 7th. Really encourage you to join that. We will have our amazing partners at Lakeridge share what they've been doing. And it will be Umali Soter who will be presenting that work, that tremendous work they're doing around implementing statements 1, 3, and 4. So really, really hope that you're able to join. It will also be an opportunity for anyone who's interested and wants to leverage the Provincial Quality Improvement Plan indicators for sickle cell to think about how they can do that within their organization. And we're really hoping there's great uptake, really great uptake of that indicator. So I'll also just mention that if you heard about some implementation resources today that you want to know more about, the e-report, the toolkit, please email us. We want to get those out to people so that they're useful. And then I think maybe if we just go to the next slide, I will always continue to put in a plug for SCAGO's amazing educational modules for clinicians. We're just so excited that we have this partnership with SCAGO and want to just highlight and amplify the amazing work they've done to create these micro lessons, short lessons for clinicians that really help to create that awareness at the front line that we know is needed. So I don't know, I'm going to just turn it over to Madeline just for a moment to see if you have any closing thoughts as sort of our co-chair in the work in developing the quality standard. Anything else that you want to share in having kind of been part of the discussions today, or anything final in terms of this important work?
Yeah, thanks so much for the opportunity, Karine. And again, thanks to the SCAGO organizers for inviting us to do this session at this event. I think the quality standards have been so important to get out there, but as many of us on the Quality Standards Advisory Committee kept on repeating, the standards are one thing, the implementation is actually everything. And so seeing the energy and the timelines and the planning and the fact that this is continuing well into fall and winter of 2024, this implementation, I think puts us in all in good position. And the discussion here today, we just see the deep investment of people from many diverse perspectives on the topic of sickle cell quality care, and see the deep commitment that everybody has to seeing this through. And I think, you know, aspirationally, and I think it's within our sights that we can really, in Ontario, be a shining light of how to enhance sickle cell care across the care continuum, you know, from infancy through to older adults, from the emergency department through to clinic, through to primary care. And, you know, I think we've got the foundation to get this right. So thank you, Karine and your team, and thanks to everybody who's been part of the discussion today.
And someone had asked for the link to be posted for the December 7th event. So thank you very much for getting that into the chat so you guys can register through the link. And we thank you very much. Please fill out the survey that is the poll that is popped up there for you. I'd like to thank our speakers today. Thank you very much, Karine. Thank you, Carol. And thank you, Dr. Madeline Borsek, for facilitating the breakout groups. You have a special session, special plenary starting at 10:05. So thank you guys very much. And we appreciate you. Oh, the other point, sorry, in the chat, someone offered, okay, hold on, there's a pediatric hematologist who wants to help. Let me go. Last name is Odami. I'm wondering a bit. Jody Odami, I don't know. I actually really don't know if that could be in relation to Dr. Isaac Odami. I am only wondering. But Peds Hemoc Fellow, eager to start a career that focuses on improving care management strategies and outcomes for patients with SCD. So therefore, and has said, please, if there's any opportunities to help, reach out to me. Email is in the chat. Okay, so it's there for you guys. jody.odami@sickkids.ca. Jody, I hope you don't mind me. I just want to blast it out there since you offered to help, because I am absolutely sure there's people who will reach out to you. Thank you guys for an awesome session, and have a wonderful rest of Summit.
Thanks, everyone. Thank you, Karen.
Thank you guys. Thank you. Thank you.